Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Arrhythmogenic right ventricular cardiomyopathy. Arrhythmogenic right ventricular cardiomyopathy, ARVC, is a genetic condition in which normal cardiac muscle becomes replaced with fibrous, fatty tissue, mainly in the right ventricle, one of the four chambers of the heart. ARVC is one of the cardiac conditions associated with sudden death, especially in young athletes. /r/n/r/n ARVC is uncommon, but not rare. It would be found in 1 out of every 2,000 to 5,000 adults if they were evaluated for it. The underlying genetic mutations that can cause ARVC may be even more common. /r/n/r/n This article explains the genetic cause and symptoms of ARVC. It discusses how healthcare providers diagnose and treat arrhythmogenic right ventricular cardiomyopathy. /r/n/r/n While ARVC is a cardiomyopathy, that is, a heart muscle disease, it only rarely causes muscle problems that are extensive enough to produce heart failure. /r/n/r/n Rather, its clinical significance is that it can cause abnormal heartbeats, cardiac arrhythmias. In particular, ARVC can cause premature ventricular complexes, ventricular tachycardia, and sometimes ventricular fibrillation. /r/n/r/n The symptoms caused by ARVC are usually related to the arrhythmias it may produce. People with ARVC will commonly describe episodes of one or more of the following. /r/n/r/n Sudden death may also occur. Unfortunately, it may be the very first sign that there is any heart problem. In up to 10% of cases, the diagnosis only occurs after sudden cardiac death or resuscitation. /r/n/r/n While ARVC can cause sudden death at any time, this event appears to be more likely to occur during episodes of physical exertion than at rest. This is why ARVC is one of the conditions that produces sudden death in apparently healthy, young athletes. /r/n/r/n However, because this can also occur during routine activity or at rest, refraining from exercise is generally not enough to alleviate the risk in people with ARVC. /r/n/r/n Between 5% to 10% of people with ARVC will have no symptoms whatsoever, or the first symptom will be death. Some of these people are diagnosed when they are screened for the disorder because a family member has been diagnosed with it. /r/n/r/n Doctors can diagnose ARVC by examining the results of heart-related tests including /r/n/r/n cardiac magnetic resonance imaging, MRI, and cardiac computed tompgraphy, CT, may help, as can other tests and techniques such as /r/n/r/n Whileelectrophysiologic testing can occasionally be helpful in distinguishing ventricular tachycardia due to ARVC from ventricular tachycardia caused by other cardiac conditions. Such testing is not routinely helpful and is usually not required. /r/n/r/n Between 30% and 50% of people diagnosed with ARVC have a family history of the condition. Genetic testing can be helpful because it can be inherited. Once the diagnosis is made, genetic screening is recommended for first-degree relatives, too. About 1 in 3 of them will also eventually develop this condition. /r/n/r/n The main goal in treating ARVC is to prevent sudden cardiac death from ventricular tachycardia or fibrillation. This may be done with /r/n/r/n The arrhythmias associated with ARVC appear to be brought out by sympathetic stimulation, part of the autonomic nervous system that increases adrenaline levels and is responsible for the fight-or-flight response. This is why exercise is a problem with ARVC. /r/n/r/n Because sudden death is often associated with exercise in this condition, athletes who have ARVC should refrain from all competitive sports, with the possible exception of low-intensity activities such as golf or bowling. /r/n/r/n. Furthermore, they should refrain from any activity that produces significant palpitations or syncope. /r/n/r/n. Asymptomatic people are also warned that intense exercise increases the risk of developing ARVC symptoms including sudden death. /r/n/r/n. Most cardiologists treating this condition recommend the use of beta blockers to blunt the effect of adrenaline in the heart. Yet for people diagnosed with ARVC who have no high-risk features on evaluation and no symptoms, treatment may or may not include beta blockers. /r/n/r/n. The American Heart Association and American College of Cardiology suggest a beta blocker may be useful. However, the Heart Rhythm Society doesn't believe there is enough evidence to support long-term beta blocker treatment for unaffected carriers of the gene responsible for ARVC. /r/n/r/n. Some people may also be prescribed an antiarrhythmic drug, though evidence of benefit remains limited despite their wide use. /r/n/r/n. Implantable defibrillators are frequently recommended for people with ARVC, especially when any of the following apply. /r/n/r/n. In people with ARVC who have had sustained ventricular arrhythmias, the long-term prognosis appears to be improved if they avoid exercise, take beta blockers, receive an implantable defibrillator, and, in some cases, take an antiarrhythmic drug. Prognosis also depends on which parts of the heart are involved and other individual factors. /r/n/r/n. A cardiac ablation may offer benefits, especially when other treatments for ARVC haven't worked well. It is a procedure used to reset heart arrhythmias, and relies on a small catheter inserted into the heart tissue. Radiofrequency ablation relies on radio waves to heat the target tissue. /r/n/r/n. 2013 study reported the average age at death for someone with ARVC at 54 years, typically due to heart failure or sudden cardiac death. But newer treatments can mean that people achieve near normal life expectancy. /r/n/r/n. Arrhythmogenic right ventricular cardiomyopathy is a genetic condition that can produce potentially lethal cardiac arrhythmias, including those that cause sudden death in young athletes. /r/n/r/n. In some cases, ARVC goes undetected until sudden death occurs, so it's important to get tested if you have a history of this condition in your family. With aggressive treatment, including medication and implantable devices, people with ARVC typically do quite well. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.